My armamentarium is my PPE, face shield, safety goggles, mask, gown, and gloves. My Marquee color-coded UNC 12 probe, or a neighbor's probe if needed. My dental mirror and some floss. The Marquee color-coded probe is used to measure and record probing depths up to 12 millimeters. The millimeter markings are color-coded in increments of 3 millimeters. So there is silver, black, each 3 increments of 3 millimeters. The primary function of the perio probe is to assess the health of the periodontium, as well as measure the cal, recession, width of attachment, size of intraoral and extraoral lesions, bleeding areas, determine the mucogingival relationships, and to monitor the longitudinal response of the periodontal treatment. To start, I would ask my patient, do you have any history of gum disease, or have you ever had any periodontal treatment? Do you have any concerns with your gum tissue? And so now I'm going to probe number 8 lingual. So number 8 lingual, we would be going from the mesial to the distal. So we would start here at the line angle, mesial line angle, and go into the underneath the caul, and then walk your probe all the way to the distal underneath the caul. Next is 14 buccal. So 14 buccal, we're going to move over into our positioning here. And I would start on the mesial line angle again and go into the caul, and then into the caul on the other side. 24 facial, I would have to move my position into. So 24 facial, we are going to be going from mesial to distal. Let me fix my hair. So we would be doing a line angle, a mesial line angle into the caul area and into the distal caul area. And I would be taking these measurements. I would do the deepest measurement for each area, whether it is mesial, facial, or distal, or mesial, lingual, or distal. There's 3 areas on each surface. So 3 areas on the buccal and 3 areas on the lingual. I have to do one more here. So number 30 lingual is going to be this one here. I'm going to move my patient's head that way. And lingual, we are going to be going again mesial to the distal. So line angle into underneath the caul, and then walk into the distal. I would check and record areas of recession, any frenal involvement, because that can cause recession if the frenum is too tight. I would measure and chart the width of attachment, which is I would be subtracting the probe depth from the gingival margin to the mucogingival line. So whatever my probe depth is, I would subtract it from my mucogingival junction to the gingival margin and subtract that probing depth. The difference is the amount of attached gingiva. If it is less than 2 millimeters, it is noted as inadequate attached gingiva. If less than 1 millimeter, it's noted as no attached gingiva. I would record any bleeding or separation I would find from probing, and then I would check the mobility using the ends of 2 single-ended instruments, like my mirror. So I would use something along the lines of my mirror and the back of another instrument and check mobility in this way and go back and forth. I would rock the tooth. I would check for any furcation and record any of my findings, whether it's bleeding, separation, furcation, anything of that sort. I would then use floss to check for open contacts and or areas of food impaction. So I would floss to find open contacts and maintain asepsis.